Welcome to the Douglas County's Chamber's Greystone Power Luncheon. I'm Roscoe Sayar with Sam and Roscoe's Restaurant and the Center at Arbor Connection, your chairman of the board for 2015. Before we start, there's a set of keys that are turned in, so if it's yours, please come and claim it.
Is it to a roll?
I have no idea, but in order to claim it, you have to buy a raffle ticket from me today. The raffle tickets are out, and there are quite a few guys here that have these tickets, so please.
I bought them from everybody, so you have to come see me from now on.
All right, Jim has got some. All right. Before we give thanks for today's delicious lunch, I would like to offer a special thank you to Jim and Nix for a very delicious lunch. Thank you so much. At this time, I would like to invite one of our chairman club board members, Frank Smith with the Care Place, to come in and lead us in invocation and pledge.
Shall we pray? Our gracious and loving Heavenly Father, we're so grateful for the opportunity to gather today. We celebrate our freedom, to the privilege of living in a country that's free, and we know that freedom came with a great price. We pray for family members that have lost loved ones in recent days, months, and years, and pray peace that would just flow upon them today. God, we're thankful for the food that has been provided, and that we live in a country of bounty. We ask that you just bless our elected officials, whether national, state, or local, that you bless our first responders, and that this day will just be anointed and used by you. For we ask these things in Jesus' name. Amen. Would you stand for the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated.
Thank you, Frank. And will all of the chamber diplomats that are present please stand up and be recognized as a group? The diplomats? All right, thank you so much. And we are also very proud of our 2015 Chairman Club members that join us today. I'm sure you have noted them on the slides prior to your lunch. I do want to say thank you and recognize the group that is sitting up front. There, and back there. I am pleased to announce that we have new Chairman Club members that are joining this group of esteemed leaders this month. I want to introduce Marvin Enderly with the Douglas County Sentinel. The Sentinel has been a longtime member and supporter of the Chamber and our community. Marvin, will you please come forward?
Thank you. I told Roscoe this would be about a 30-second elevator speech. I'll keep it short. If you're not aware, just tell you a little bit about the Douglas County Sentinel and newspapers of West Georgia. Basically, we have 7 newspapers that serve communities from Douglas County west into eastern Alabama. A couple of magazines to go along with that. Been here a little over a year and have found Douglas County, West Georgia, an excellent place to live, work, and do business. And I would be remiss if I did not give kudos to the Douglas County Chamber. I've been in a lot of communities, and this chamber is fantastic. So folks, please take advantage of it. Most of the contacts I've had or made in my short time here have been through the chamber, so they do a great job. Please take advantage of it.
At this time, I would like to invite our luncheon sponsor, Craig Owens, president of Wellstar Douglas Hospital, to come forward and say a few words and give us an update on what's happening in our community hospital.
Good afternoon, everybody. Thank you so much for the opportunity to participate in today's lunch and to sponsor. We're very excited to be here and to hear Ms. Crossman speak about the challenges that we face and the demographic issues that we have in Douglas County. As we were sitting here talking, we were talking about the access issues and some of the challenges, and I wanted just to speak briefly about what you've probably all heard in the news about the Emory and Wellstar merger. We are going to be out, our senior leaders from the organization, talking in more detail about what this means for our community. But just very briefly, in the event you haven't heard, Wellstar and Emory Health System are working towards a merger. We're looking at actually coming together and more than a partnership of actually merging the two organizations in a pretty much a 50-50 arrangement. So the two boards, the two operating boards, have been meeting and talking and looking at the landscape. But what's different about this merger is that, you know, we're out there talking about this and looking for community feedback, whether that be questions or whether it be concerns about the organizations coming together. I do think that some of the benefits that we'll see as a result of this merger will help us meet the challenges in the future for our communities. Ms. Crossman and I were talking about the fact that, by the way, anybody in here born before 1964, and will admit it? Okay, so I was born in December of 1964. I'm one of the last baby boomers to make it into this world, and those of us that are in that generation are now entering into the peak of our healthcare utilization years. I'm trying to say that in a nice way. But about 10,000 baby boomers a day are enrolling in the Medicare system. Just think about that for a second, and the challenges that presents to us as a country. You know, the healthcare system has to change to meet those demands. So the merger of Emory and Wellstar will make that system a stronger, more viable solution than what we have with disparate independent entities in this market. So I'm very excited about that. And if you have questions or you would like someone from Wellstar to come and talk to a specific group, please pull me aside, let me know, and we'd be glad to arrange for one of our senior leaders to come and talk a little more about this development and what this means for our communities. And if you have other questions, I've been instructed that we have an email, communityfeedback@wellstar.org. So if you're a technology-based person and you'd like to get some answers in that regard as well, reach out to us and we'll be glad to share more about the development between Emory and Wellstar. We are still in our 45-day discovery period and relationship building period with Emory, so in very short order, a final decision should be forthcoming about the merger. So thank you very much.
Thank you, Craig. We appreciate all that Wellstar does for our community, and thank you for your continued support of Chamber and its programs. Now it is my pleasure to introduce today's guest speaker, Lisa Crossman, with Cobb Douglas Public Health. Lisa Crossman serves as the Deputy Director for Cobb and Douglas Public Health. She is directly responsible for the Center for Community Health, which works to develop partnerships to fulfill the Live Healthy Douglas Community strategic health improvement plans related to improving access to health services and improving healthy lifestyle. That's the longest sentence I've seen in a long time.
Just saying.
Lisa has been helping our residents reach optimal health and well-being through individual wellness, physical rehabilitation, and health policy efforts since 1982. Ladies and gentlemen, Lisa Crossman.
Well, good afternoon. Thank you so much for having me here today. I'm excited about sharing this information with you. I will try, Craig, not to make it too depressing for our health stats. There is good news, there's opportunities, but there's a few things that we also need to be aware of. So the first is, let's see, that every single person in this room is part of our local public health system. Many times when people think about a community's health, they think, oh, that's the health department's responsibility, or that's WellStar's responsibility, or that's my doctor's responsibility. But I'm here to tell you that every single person in this room is responsible for the community health status of Douglas County. You are responsible because you make choices every single day about your own health, about how you exercise, how you eat, how you manage your stress, whether you go to the doctor for annual checkups. So you are absolutely contributing to the health status of the community by the personal choices that you make. You also are very responsible for our health because you make decisions for your family and for your business and for your circle of friends. You influence health in this community every single day when you get up. So I would say to a group like you, filled with movers and shakers in this community, that you all are just as important to the health status of this community as you are to the economic development, to the education system, to all of the other components that you put priority on. So health, I believe, is just as important. Let me ask, before I move on to some of the health status, if I could have members of the Cobb Board of Health, members of the Douglas Health Futures Foundation, and members of the Live Healthy Douglas Coalition, if you all would stand, please. Some of you, like Dr. Pritz, and Tom Wortham, y'all are going to have to stand up and down a few times because you wear several hats for us. But those folks who just stood up are some of the main leaders when it comes to making healthcare decisions or health decisions in our community. And so please refer to them and talk with them if you have questions about any of the information that I go through today. First of all, just a couple of points on our vision and our mission with public health. So one of the key components here is that with our partners, public health has one of the most wonderful roles, I think, in the community of being able to put folks together to accomplish health goals. I love that part of my job of being able to put this business with this business or this individual with this individual to make the community better and healthier for our residents. I also will point you to our vision to be an acknowledged leader in the United States. We are pursuing public health accreditation. Recently, in the last few years, there was an accreditation process that's voluntary for public health. We have been on that road to apply for accreditation, have gone through the application and the site visit, and I am fingers crossed that in June we will be the first health district in Georgia to be accredited. So fingers crossed. It was a long road. For those of you who work with agencies that have to be accredited, like the hospitals and the education systems, you know that's not a quick process. I know this slide is scary because I could spend about 6 hours on this slide telling you about some of the services we provide. I just wanted to provide this as a snapshot to give you an image of the scope of services that public health provides to this community. There is not one person that I meet in Douglas County who is completely aware of all the services that public health provides. Most of the time I get, wow, I didn't know you guys did that, or wow, really, you all do that? So my point in showing you this slide is just so that as business owners, you realize the scope of services that public health provides and the resources that are available to you and your business. Because we want to be that resource. If we can't provide the service, it is our job and one of our primary areas of focus to know who does in the community. So if we can't provide it to your business or to your employees, we absolutely can work with you to find out who can and to put you in touch and make that introduction. So these are some of the different services. At the end, if there's questions about these particular programs, I'm happy to answer questions about it. A few highlights about Douglas County. All of this information, by the way, is on our website in a document called How Healthy Are We in Douglas County? So I invite you to go to that website. It is an important role for public health to serve as the keeper of the data. We often work with CDC, state public health, many agencies to collect the information about what's the health status in this community. And so we want to be able to provide that to whoever needs it and wants it, because we want you to use your resources for the solutions, and we'll talk about the solutions shortly. So many people go, okay, we need to do a community needs assessment, or we need to do a health needs assessment before we step out and make some decisions about what programs or services we will provide. So my hope is that you will turn to public health and say, give me the data, so that you can then use your resources for the solutions. So in Douglas County, a few pieces of information. First of all, the county continues to grow. That's good news. We're mainly seeing increases in the minority populations and in the ethnicities. So that adds a different level of complexity to providing health services or all services in the community. We also, I think it might be interesting to you that 65% of Douglas's population is under the age of 45. Craig, you talked about the baby boomers. I am one of them. I am not under 45. I wish I could say that. But 65% of Douglas County is under the age of 45. That makes some real, that's an important component for many decisions that you'll make as a business leader, and it certainly makes a difference in the health care approach, and you'll see why in a minute. The largest group in our community, Gordon, you know this, is under 17 years of age. So 37,000 people in our community are under the age of 17. Now, why is that important? Let's look at the leading health concerns. I don't think this is going to be any surprise to you all. I know that we get really excited and frantic about things like Ebola and measles, and I can tell you that public health ramps up and we work on those and drop everything to make sure that the public is protected against things like that. But I will tell you that the diseases and the issues that are listed on this slide are more critical to the health of our community than things like Ebola and measles. And if we could ramp up and all rally together like we do for those kind of crises, then we could solve this issue. If we don't get on top of things like heart disease and the diabetes and other infectious diseases, motor vehicle accidents, all the things you see listed here, if we don't get on top of those things, for the first time in history, listen to this, for the first time in history, our children will have a shorter lifespan than ever before, than any of their parents, than any time in history. Throughout our country, children have always ended up with a longer life expectancy than their parents, right? It is just a cultural expectation. We are in the situation now that if we don't get on top of some of these issues, our children could have less productive years of life and could have a shorter lifespan than their parents. I don't know about you guys, I have a 14 and an 18-year-old daughters. That is not the future that I want them to have. So if you don't do anything for yourself, right, if we don't believe in making some of these lifestyle changes or these community changes for ourselves, then I would bet, knowing the folks in Douglas County, you would absolutely get on board with rallying to make the community a better place for our children. And this is critical that we do this. Some of the recent health, this is where Craig thought it was really depressing. And it is what it is, so I'm just going to share it with you. So we do have a recent health assessment. This kind of tells you what we're facing in Douglas County. About 25,000 residents do not have health insurance. We are not seeing the benefit yet of the Affordable Care Act insurance. We still have 25,000 that are either showing up in the emergency room at Wellstar, they're showing up at the care place, or they are not seeking care. and they're living with some of these problems, the diseases. We have all of the lifestyle-related issues that I mentioned to you. 71% of us say that we're either overweight or obese. 71% of us. And let me tell you guys, this is a self-report number. And I've been in healthcare for about 30 years, and normally on these things, I'm taller and lighter than what I report, right? Most people are taller and lighter than they report, sometimes both. So to have this number be 71% of us who think we're either overweight or obese, that's scary. And that has huge ramifications to many diseases. The smoking rate is coming down, so that's good news. That's a lot related to some of the policies that many of you all have implemented over the last 10 years, really. Douglas County, I'm so proud of this community that back in '05, you were one of the first to implement many sweeping changes related to tobacco policy. School system was a leading school system in the state for implementing tobacco-free policies. And so the smoking rate is coming down, but we are not quite there yet. This is a group who's trying to do something about it. The Live Healthy Douglas Partnership is a group of community leaders who have come together. Tim Williams, Tim, where are you? Right there. Tim Williams is our chair and serves to lead a group of about 15 community leaders who have overseen an assessment for the community about what are the needs. They have implemented or developed a community strategic health improvement plan and now are working it day after day to try to make those improvements and make those things come to fruition. Some of the areas that they're focusing on are the healthy lifestyles and access to care, and I'll talk a little bit about some of their successes in a second. Bev Kartheiser and Frank Smith are leading two of our implementation teams. Frank, you're here, right? Care Place, thank you very much for your service. And we continue to focus on those two big buckets, or those two strategies. So a few successes. You have a flyer on your table that highlights some of the successes that Live Healthy Douglas has had this past year, but these are some of the things I just wanted to hit as a highlight. I already mentioned the clean air efforts. The Power and Truth, many of you are involved in that, and that's an annual meeting that we sponsor for middle school. Tanya, where are you? Thank you. You have been critical to that Power and Truth conference. And we sponsor that every year and will continue. We think that's just a real gem in this community to help teach our middle school and high school folks about how to avoid peer pressure, how to set lifestyle goals, how to avoid being influenced for unhealthy behaviors. The Care Place, I mentioned that. Frank was so excited to have the Care Place launching. Again, I've been in this community since 1985 when I joined Wellstar at the time. I was working for Wellstar, and it's been a struggle for decades trying to get a primary care center and to get primary care physicians in this community. So thank you for the effort that you and your board are making to try to make that better. And then last, I mentioned the Douglas County Schools. Dr. Pritz, I am so proud of the school system. You guys always are stepping up and one of the leaders in the state for things that are not just education focused, but that are truly trying to make our children healthier all the way around. So the school system is one of the first in the state to endorse and embrace the Power Up for 30 concept. This is a statewide initiative where public health is working with the Department of Education to try to get our children more active 30 minutes a day outside of PE and recess. Power Up for 30. 30 minutes every day outside of PE and recess. The Douglas County school system was one of the first in the state to say, you know what, we'll get our teachers trained and we'll embrace that concept. And they've got teachers now teaching social studies and other activities actively. Wouldn't it be amazing if, as business leaders, we said, you know what, I'm going to take that Power Up for 30 concept into my own business. And I'm going to figure out a way in business meetings or stretch breaks or walking meetings in my business to power up for 30 during the day. There's a thought for this group. So here are some of the Live Healthy Douglas priorities. I've got to be able to call attention to the Care Place and to Frank and advocate for his priorities as well. We're working really hard to support the Care Place and increasing the number of volunteers, medical volunteers that are supporting that agency. Thank you to Wellstar for stepping up and providing a lot of support to that, and also Kaiser Permanente. Both agencies have really stepped up to help get the ball rolling. And now we just need additional folks so that Frank can open more hours and serve more patients. We're also looking at the medication assistance program because we know that you can't just provide primary care. You can't just provide a doctor for folks. You've got to be able to have all of the medications that somebody who comes in needs in order to keep their chronic disease under control or from increasing. So it doesn't work to come in and go, oh my gosh, you've got high blood pressure. Wow, see you in a couple months. You know, and have the person go, I have no way to get high blood pressure medication or cholesterol lowering medication. So we've got to be able to make that resource available easier, because it's pretty burdensome now to try and find those resources for those patients. You can see some of the choices with our Healthy Lifestyle I-Team. So we are trying to see if working with a variety of events. So let's say Georgia Power. Tim, where are you? Let's say Greystone Power at your annual meeting, right, in October. Can we come? Sorry about that, John. Yeah, I'll get to you in a second. So annual meeting with Greystone Power to be able to have more activities as part of your annual meeting, right? And have it be a tobacco-free event, have healthy food, and to do things that start to change the culture about these events. Wouldn't that be exciting? More fresh fruits and vegetables, and increased choices. So let me go on record here, because a lot of times people go, oh my gosh, there's that public health woman and she's going to tell us that we can't have our barbecue. Let me tell you, I love Jim and Nick's and love the lunch that you all had. I would just say that if you had a really large portion of their wonderful mac and cheese today for lunch, that maybe you balance it out with a few vegetables tonight and create that balance in your day, right? Because it's hard to resist the mac and cheese, let me tell you. We are in for choices. So we are not trying to get you to never have a soda again, right? And have it be the soda Nazis. We are saying let's have choices. Let's make choices so that at your meetings you don't just have donuts and coffee. But could you offer water and maybe some fresh fruit at your business meetings? That's the kind of thing that in your workplace can help make a difference. Now let's talk a little bit about the worksite wellness policies, because that's what I hope you'll walk away with today, is an awareness and a motivation to say, you know what, we need to do something collectively. What can I do to start, even if it's just one minor, small step? What can I do with my business, with my family, to walk towards this goal of a healthier Douglas community? The cost of employee health, I've been in worksite wellness for 30 years. I tell you, I am just, we have all of the data to show you as a business owner that it makes sense from an economic perspective, from a health perspective, from your profit margin perspective, to be able to have some worksite wellness activities that you offer during the workday. Your employees spend 8, 10, 12 hours involved with your company. We've got to be able to address some of the things to make the healthy choice the easier choice for folks when they're at work. This was a study that was done by the Harvard Medical Schools that showed the total cost of poor employee health is about $13,000 per employee per year. $13,000 per employee per year, the result of poor health. These are just some of the things that seem to be contributing to those costs. You can see that along my point across on this slide is to show you that these are the things that particularly impact productivity. So back and neck pain, depression, fatigue, chronic pain, all of those issues tend to be some of the top cost areas in business related to productivity. And you can see the difference in the bars is just outpatient, inpatient, drug-related cost, absenteeism from work, and then the term that I'm assuming you've heard before, the presenteeism, right? They show up for work, but they're not terribly productive that day. You'd almost rather them take a sick day, right? And so we count that cost as well. So what are some things that you might do? First of all, I would say please try to find a way for your employees to have access to a primary care provider, whether that's through your insurer or linking them to places, calling public health, calling CarePlace, let us help you get these employees to a primary care provider, because that can make all the difference in the world to their annual checkups and screenings and also their regular immunizations. I have to do a little plug and wear my public health hat here and say I really would encourage folks to make sure they're getting all of their adult immunization that's recommended. We always, I hope you've heard about flu shots, right? Every year that you need to get your flu shot, and we highly encourage that. But as public health, I'm also encouraging you, if you have not had a pertussis booster, remember whooping cough years ago, a pertussis booster, and you are around young children, you really need to get a pertussis booster, because we are seeing a rise in pertussis, mainly because as adults, sometimes our immunity has waned, and we might get a bad cough and think, man, that's a really bad, just hanging on cough. But if we're around these young babies that are not fully immunized yet for pertussis, then we're passing that on to them, and it's causing severe problems for them, sometimes death. So regular immunizations, if you don't know which ones you've had or should get, then again, call public health. I can get you in touch with some folks and we can help you find out what those are. Encourage regular hand washing. This sounds like something your mama would have told you, right? Wash your hands. But we could just protect so many people in so many places if we'd all just wash our hands more, truly. So if you can be the models in your business, in your family, in your community, to washing your hands on a regular basis, particularly after the restroom, particularly before eating, it's huge. It would make a huge impact. Maybe you would consider signs in your business, in your restrooms. Maybe you would consider hand sanitizers in some of your key areas where a lot of employees are. It makes a difference. It sounds so elementary, but my goodness, if we just do it, it would make a huge difference. Assuring tobacco policies. I hope that many of you, since 2005 and the clean air laws passed, that many of you or most of you don't have smoking in your facilities, in your businesses. If you do, if you were exempt from that, please make a note. I can provide you with a model policy like that. You or your HR folks do not have to do any work. And it would make a difference if we could get our employees, our folks, to stop smoking and our youth to stop starting smoking, then we would make a huge difference on some of these chronic diseases. Georgia Public Health offers a free tobacco quit line that provides telephonic counseling and resources to folks who want to be able to quit, and connects them in their own community with other resources and counselors if they need that. Healthy meeting policy. Again, I can provide you with a policy like that. You do not have to do the work. It's a place that you could at least start discussions in your own company. Wow, could we have an expectation that at our meetings we're going to offer healthy choices of food? Could we offer some stretch breaks during our meetings? What if you, as the leader of your business, agree to have 2 hours of walking meetings a week? so that whoever signs up, like Monday afternoon, if somebody has a meeting scheduled with you on Monday afternoon from 3 to 5, it's going to be out walking around your business while you meet. Doesn't have to cost you. You don't have to spend money on sponsoring fitness center memberships. That'd be great if you do that. But there are other things that you can do. Bottom line is that you find a way to make the healthier choice the easy choice for your employees, for the community. There's 4 areas I would recommend, okay? Write this down or commit it to your memory. Get checked. Don't smoke. Move more. Eat well. Get checked. Don't smoke. Move more. Eat well. If we could keep those 4 things in our mind on a daily basis and try to more often than not to make those choices, our stats would be much more encouraging. So this is a plug for our Douglas Health Futures Foundation. We have a public health foundation that works to raise money for public health needs. And so some of you might go, wait a minute, I thought you got all your money from the federal government or from state government. Well, no. First of all, let me show you this. Government funding covers about half of the money that public health needs to provide the services, whether that's restaurant inspections, body arts inspections, childhood immunizations. We get about half of our budget from state and federal sources. Funding is down about 20%. We were hit just like everybody else was in the recession. Funding is down about 20%, but just like Craig mentioned, demand is up, right? Douglas County population is growing. Some of the poverty rate numbers seem to be going up a bit. A lot of folks were hit with the recession of a few years ago, which means that the demand for services in public health, in WellStar, for your uncompensated care, for the care that has to be provided without anybody providing funding for it, all of that has gone up. So we work in the community to try to raise money to help subsidize those services. And so several of the folks that stood up work with our foundation. Dr. Pritz is our chair of our foundation, and our main focus there is to raise money for children's programs, things like Safe Kids, Babies Can't Wait, and children's medical services. And I would ask you all to keep an eye out, because in the fall, August maybe, we're planning a breakfast so that you can come and learn more about some of those issues and the childhood health issues in this community. So, my call to action, if I can be so bold. The first is I would ask you to either have someone in your agency or yourself in the next 2 weeks go and visit our website, cobbanddouglaspublichealth.org or the healthydouglas.org websites. It will not take a lot of time. Just make yourself more informed. The second is I would like to ask you to commit to at least one worksite wellness policy that you have not implemented for your own employees within the next 3 months. There are a lot of resources in this community that could help you do that. It is not burdensome. You do not have to have one employee who can spend 20 hours researching how to put a healthy meeting policy or a tobacco-free policy or any other policy that would fit with your business. We have those resources. We can at least give you a template to start and put you in touch with resources that are medically sound, reliable, and that have been best practice tested across the country. So I would ask you to commit to one worksite wellness policy in the next 3 months. And then I would ask you in the next 6 months to consider coming to our breakfast in the fall for Douglas Health Futures, or becoming involved with Live Healthy Douglas and how you could make a difference in wherever it fits for you to plug in. There are lots of opportunities, for you to plug in with as little time or as much time as you see fit. Thank you for your time today. I would love to answer a couple questions if you've got time. If not, then thank you for your attention today. Okay?
Are you going to be here after the meeting?
Yes, so I will stay after the meeting to answer some questions. If I could ask, can I get them to stand up?
Absolutely.
So if I can get you all to stand up, because I can't talk about stretching and meetings and all that without having you do that. So everybody just stretch up. Roll your shoulders around. Stretch one arm across. The idea is to go to a point of tension but not pain. All right, reach out and wave goodbye. Thank you so much.
Thank you so much.
Thank you.
Thank you, Lisa, for taking time out of your busy schedule to join us today. I would like to inform you that a donation has been made in your name to our Chamber High School Scholarship Fund for a new scholarship to be awarded this year. We appreciate your time. Thank you.
So much.
We would like to officially welcome Ms. Janet Kelly as the Chamber's first Membership Development Specialist. Yay! Janet will be working out in the community to grow Chamber's membership, and so please make sure that you share any kind of leads that you have with her. Thank you, Janet. Also, we'd like to inform you that the application deadline for Leadership Douglas program has been extended to March 25th, so you still have time to go ahead and fill out the application online. I do encourage you to please consider that if you have not taken part in that program before. Please note that the April 21st luncheon will be held at the Douglasville Conference Center and will be our legislative luncheon. So please be sure to mark your calendar for the new location. Thank you to Greystone Power for their naming and sponsorship and the use of their facility today. Thank you to Jim and Nick's for great food and to Velastar for sponsoring today's luncheon. I would like to ask Greg to come up here for a moment, and we have some awards. The first one is a stadium bag, or stadium seat, right? There will be two of them. The first one is 510118. All right, come on up. And the next one is several gift certificates by Jim and Nick's, each for a different item. And the number is 510248. 510248.
The next one is going to be $25.
The next one is a $25 gift certificate to a restaurant of your choice that is a chamber member. 510114. 510, oh, there it is. Thank you, Craig. Thank you to Velastar. Couple more announcements. Thank you for attending the meeting today. Please keep in mind that the next business after hour Comcast function is on March 26th, and it will be at the Service First Bank on Chapel Hill Road from 4 to 6. Please make sure to mark your calendars and attend that event. Also, our next coffee card exchange will be on April the 2nd at the Central Baptist Church at 8 a.m. And I would also like you to mark your calendars that immediately after that coffee card exchange, the Special Olympics are taking place that day, starting at 9:30, and we would like for you to, if you can, to attend and support that program, which is very, very important and growing in our community. Thank you for being here today. Enjoy the rest of the day. And if you have lost this set of keys, please check it out. It's up here. Come and take it. Thank you.